So good morning, everybody. Welcome to the 2020 Open Enrollment. On the screen are some items that we're going to be covering today. We're going to cover your medical. No changes to the medical. We are introducing a new dental plan and vision plan, and of course you have your voluntary options available. Your open enrollment period begins today, and you have until December 9th to complete your enrollment form and get it returned to CBR. The options that you'll review today are going to start January 1st, 2020 until December 31st, 2020. In regards to eligibility, all full-time employees working 30+ hours are eligible for the benefits, aside from yourself, your legal spouse, domestic partner, and children up to the age of 26. Now, in regards to children that turn 26 during the plan year, they will be covered until the last day in the month they turn 26. Then they will be given a COBRA packet to continue their coverage if they would like. As I stated earlier, these benefits are going to start January 1st, and you are locked in for those full 12 months unless you experience a qualifying event. Some of those events are listed here on the screen: so marriage, divorce, loss of coverage, birth of a child, adoption. If you're covered today on a Medicare or Medicaid type plan, or you're on the exchange, you actually get 60 days versus 31 days for all other events. Just make sure to contact your HR representative here at CBR when you've experienced a qualifying event, so you have the opportunity to review all of your options. All right, we're going to go over the two medical plans that are available. No change to the plan, same network. So the network is called the Open Access Managed Choice Network that has, a lot of coverage throughout the United States. Here locally in Arizona, you have Phoenix Children's Hospital in the network, and you also have the Mayo Clinic in the network. First plan is a $1,500 deductible as an individual, $3,000 as a family. So what applies to deductible on this plan is going to be your major medical, such as inpatient, outpatient surgeries, MRIs, CAT scans, things of that nature. If you go to the emergency room and are admitted, you start to pay towards your deductible. All other services are going to be covered as co-pays. If you go in for your preventative, that's covered at 100%, and the physician sends you to a lab, make sure that it's an in-network lab. It's still your responsibility to find out and make sure and confirm that the lab is in-network. I know sometimes physicians give us the slip and tell us to go to a lab, but they really don't give us a name. So go either on your phone or go to Aetna.com, type in your information, sign in, and look for that lab that's going to be in-network. So if you happen to meet your deductible on this plan, then you're going to go into the cost share, which is 70/30. What that means is at that time, Aetna will start to pay towards your services 70%, and you're going to be responsible for 30% until you reach that out-of-pocket maximum. So your out-of-pocket maximum on this plan is it's going to be $4,000 as an individual or $8,000 as a family. Now, if you should meet that out-of-pocket maximum in a calendar year and in-network, you would be covered at 100%. No more co-pays for pharmacy, doctor visits, therapy, surgeries, things of that nature. As I stated earlier, the preventative care is covered at 100% on both plans. That's your well woman, well man check, and of course the children physicals, immunization. That's all going to be covered. On this plan, if you need to go in to see your doctor for a sick visit, so that's going to be your regular doctor, primary care physician, your walk-in clinics to the Minute Clinic, Little Clinic. Here in Arizona, there's a CVS walk-in clinics and Fry's, ACOs, things, as long as they're in the network, it's going to be a $35 copay. That $35 copay also applies to your telemedicine through Teladoc. The specialist visits on this plan is going to be a $50 copay, and you can self-refer on either plan to specialists. You do not need your physician or primary care physician to write you a referral. You can just go online, find the specialist, and make your appointment. Your urgent care is going to be a $75 copay, and your emergency room is going to be a $250 copay. As I stated earlier, if you go into the emergency room and you have to be admitted, which means that you're going to be spending the night, they're probably going to waive that $250. However, at that point, you will start to pay towards your deductible. You also have pharmacy available at a copay. It's a 30-day retail supply. Your generic medication is going to be either $3 or $10. Your preferred brand name is going to be $35 copay. Your non-preferred brand name is going to be a $60 copay, and your specialty medications such as infusion, injectables, 25% up to $250. Now you also have the ability to get your prescriptions via mail order. So you can get 90 days worth of medication for 2 copays, so you save a little bit of money there. If you're on any expensive type medications, you can go to the Costco pharmacy. So it's a standalone pharmacy. You do not need a membership to fill your prescriptions. You can download the app GoodRx, GOODRX.com. Type in your zip code, and then you'll have access, type in the type of medication you're taking, and the information that you'll receive will be, areas within your zip code where the medication is the least expensive. So you'll get a nice big list, and it'll include the Costco's, the CVS, the Walgreens, Fry's, etc. in your area. Any questions on the Open Access Managed Choice 1500? All right, the next plan is called the Open Access Managed Choice HDP 3500, or a high deductible health plan. So on this high deductible health plan, deductible applies to all services. So your sick visit, your pharmacy, your inpatient, outpatient, therapies, even pharmacy, everything is going to be subject to your deductible first, with the exception of 3 items. Your preventative care is covered at 100% prior to your deductible. Preventative medication and FDA-approved contraceptives. Those are going to be covered at 100% prior to your deductible. If you're thinking about enrolling in this plan and you want to find out where your prescription falls, you can email me and I can look at the formulary and let you know if it's going to be covered prior to the deductible or after the deductible. So on this plan, you have to meet your deductible first with the first visit. If you have to walk into your doctor's office, you're going to pay the contracted negotiated rate. That applies for regular physician visits, specialist, urgent care, emergency room. You're going to pay the contracted negotiated rate. If you meet your deductible at $3,500 as an individual or $7,000 as a family, then you're going to go into that cost share scenario where Aetna is going to pick up 80% of the cost, and you're going to pick up 20% until you reach that out-of-pocket maximum. Again, if you meet that out-of-pocket maximum, you will be covered at 100% for all services, including pharmacy, in-network and within the calendar year. If you enroll in this plan, then you have the opportunity to open an HSA or health savings account to go along with the high deductible health plan. You do not have to open an HSA, but it's recommended, since the company does give you HSA dollars, that you open that account. So we'll go over the HSA and how that works and some changes for 2020 in the next slide. Does anybody have any questions on the high deductible health plan? Okay, we're going to move to the next slide, and the next slide is going to be, the high deductible health plan and the HSA paired together. Again, you do not have to have an HSA, but it is recommended that you do. It gives you the opportunity to put away pre-tax dollars, so that helps in lowering your taxable income. So aside from what the company is contributing towards your HSA, you also have the opportunity to set additional dollars aside. There is no minimum, but there are maximum in a calendar year. So for the 2020 plan year, as an individual, the most that you can contribute into an HSA is $3,550, and as a family, it's $7,100. Now, as a family under IRS rules, a family is described or as 1+. It could be you plus a child or spouse, or an entire family. Now, if it's an individual, as an employee, you enroll in a high deductible health plan, and your spouse or domestic partner also enrolled in his or her high deductible health plan, combined, you cannot exceed the $7,100. If you are 55+, then you could add an additional $1,000, what they call the catch-up provision. So making it $4,550 for the year for an individual and $8,100 as a family. There are some caveats to opening a health savings account. Number one, you have to be enrolled in the high deductible health plan. You cannot be enrolled in the copay plan. You have to enroll in the high deductible health plan or qualified plan to open up your HSA. You cannot be covered under a different non-qualified plan, such as a copay plan. You cannot be enrolled in any part of Medicare, and you cannot be claimed as somebody's dependent on their tax returns. Just some important rules that the IRS sets for the HSA. Does anybody have any questions? So the HSA, those are dollars that are yours. Those are dollars that you can carry year over year as long as you remain enrolled in a high deductible health plan. You can continue to contribute. You can continue to add up, stockpile that money. So in the event that you need it, it's available to you. There is no use it or lose it provision with an HSA. If you leave the company, you take the money with you. As long as you enrolled in a high deductible health plan, you can keep adding money. If in 2021 you decide you don't want to enroll in a high deductible health plan, you can use those dollars to pay for qualified medical services such as co-pays, prescriptions, dental, vision, LASIK surgery, chiropractic services. There's a nice big list of things that you can use those HSA dollars for. You can no longer contribute towards your HSA, but you can use those dollars to pay for services. And the money is made available to you as it's deposited into the UMB account. Next, we're going to go over the flexible spending account. So again, pre-tax dollars that you set aside. So if you enroll in the high deductible health plan, you cannot enroll in the flexible spending account. It's recommended that you enroll in the HSA and not the FSA. So similar to the HSA, the FSA pre-tax dollars, the maximum for the 2020 plan year on the flexible spending account is $2,500. It does have a $500 carryover provision into 2021. Anything in excess of $500 will be forfeited. If you have any money today in that account, over $500, I highly recommend that you spend it. There, you can go on Amazon. Amazon now has an FSA store and an HSA store. And there's also FSAstore.com that you can go and purchase items on there using your FSA dollars. So the FSA card that you see here on the screen is loaded with whatever amount you elected. If you elected the full $2,500, that's available to use beginning of the year, and then it's payroll deducted for the next 12 months. If you leave the company, you do not keep the money, it stays behind. So that's another thing that's very important. You can use it also similar to an HSA for medically qualified expenses or eligible expenses, co-pays, LASIK surgery, orthodontia, pharmacy, things of that nature. So you can use those dollars similarly to an HSA, but there is some differences in the carry forward and then the use it or lose it provision. You also have dependent care FSA. So again, up to $5,000 of pre-tax dollars you can set aside to pay for eligible daycare and elderly care services. And that money is taken out of your check per pay period and put into an account to utilize to pay for those services. Again, if you leave the company, that money stays behind. Does anybody have any questions? Okay, the next we're going to go over some of the Aetna resources that are available to you. So the Nurse on Call is available 24/7, 365. It's a good place to start if you have questions in regard to drug interaction, new prescriptions. They will have your medical information, diagnoses, and history of medications on available to them so they can speak to you in regards to that, make recommendations if you should go to the ER, emergency room, urgent care, or just wait for your primary care doctor and set up an appointment. And that also has the mobile app that you can download. You have your card on there. You can find a pharmacy or urgent care that's closest to where you are. And then also on the screen is your teledoc services. So if you enroll in the high deductible health plan and you need to use the teledoc services, it is going to be a $45 copay. For the other plan, you can pay the primary care physician copay. So the $45 is only for the high deductible health plan. All other services depend on your plan. So teledoc, if you're not registered, I recommend you go in and register before you use the services. You'll have to answer some questions and also provide a form of payment. You can use your FSA card or your HSA card to pay for these services as well. Next, I'm going to introduce something new that Aetna has rolled out in a partnership with Apple. So it is a wellness program that they've worked together on implementing. It is tied to an Apple Watch and an iPhone. So it's an app that you download to your iPhone, You pair either your current Apple Watch, or if you don't have an Apple Watch, you have the opportunity to purchase a watch. Depending on the model that you select, it's what you're going to pay. So it could be as low as $8 per month, and it is a 24-month contract with Apple. Again, if you have a watch, then you can start to utilize the app and start to gain points towards gift cards and meeting your wellness goals. So just some information here on what the wellness initiative is. So Aetna will send you goals to the app on your phone, such as getting your teeth cleaned, going in to see your primary care physician for your wellness visit, taking a few minutes for mindful breathing. It measures your steps, your standing time, and you get points for doing all those things. And those points, if you purchase the watch through this opportunity, it starts to minimize how much you owe per month. It could be free. I've been on this app for 5 months and I've yet to pay anything for the watch because I've met all of my goals. It is 8,000 points per month, but like I stated, the items that are sent to the app are very doable. If you want to go running, do Ironman competition, all that good stuff, you are more than welcome to do so. But the items that are sent, or the wellness goals that are sent, are very doable by everybody. So the app looks like this on your phone when you download it. It's called Attain. As you can see on this one, this person probably purchased a watch that's a little bit more expensive. So they've attained 8750 points, and at that point they only owe $2.75. Again, my watch is $8 a month, so when I reach my 8,000 points, I owe zero. So this person may have purchased something a little bit more expensive than what I did. You have the opportunity to review all the selection of watches. So, you go in and you meet your app, your goals, you'll see on the screen where you are, how many calories you've burned, etc. It's really fun, kind of challenge yourself as well. These are actual screenshots from my phone of what the app looks like when you download it and you start to maneuver your way through it. Again, this is actual from October from my phone. Healthy action. So a healthy action could be just a few minutes of breathing. It could be acknowledging something that Aetna sent me that said, don't give in to your cravings, or things of that nature. Get your flu shot. So very simple items, like I stated before. And this is an actual screenshot again from my phone. And at this point, I had only obtained 845 points. So I owed full $8. And it says there on the bottom, get your 8,000 points per month and you will owe nothing on the phone. And then any points in excess of the 8,000 for me, I can purchase gift cards. So that is available to everybody. So Amazon gift cards, iTunes gift cards, CVS, Fandango, Best Buy, Walmart, Target. There's a nice big list of gift cards that are available to everybody. So if you have the opportunity and you have the iPhone, I recommend that you go in, poke around. You don't have to commit to it. If you just want the watch, you don't have to commit to anything. But there on the screen, you see you challenge, go for a walk, 100 points, things of that nature. So it's very attainable. If you have any questions or need additional information and you haven't received your mailer yet from Aetna, you will be receiving it if you're enrolled in Aetna. Unfortunately, right now, it's only for the iPhone and the Apple Watch, but they are looking at changing that in the near future. Any questions on that? All right, so next we're going to introduce the new dental plans. These are with Delta Dental. That is effective January. So if you're enrolled today in the Aetna dental plans, they will be terminating by the end of this month. If you are enrolled in the DMO plan with Aetna and you have a child undergoing orthodontist services, reach out to us, because there's a form that we would like you to complete, because Delta Dental has agreed to take those services on. And if you've already paid your $2,400, that was the copay with Aetna, that's all you have to pay. So Delta Dental will continue with the services, and you will not have any more out-of-pocket expenses. So the PPO plan, similar to today's PPO plan, you have $1,500 to use towards your dental services. So your preventative services, your cleanings twice a year, and your x-rays are going to be covered at 100%. When you utilize basic services such as a cavity, that's where you're going to pay that deductible of $50 as an individual or $150 as a family. Then Delta Dental is going to pick up 80% of the cost, and you will pick up 20% of the cost. Major services such as a crown, it's a 50-50 cost share with Delta Dental and yourself. Again, if you have not paid that one-time deductible, you'll be subject to it at that time. If you never need to utilize those basic or major services, you will never be subject to that deductible. Again, the annual maximum on this plan is $1,500 to utilize towards services for every person enrolled in the plan. And then an enhancement to this plan is an additional $1,000 for child orthodontia, and it's a one-time benefit per child. And as you can see on the screen, the plan or the Delta Dental plan pays exactly the same whether you're going in network or out of network. So if you have a dentist that doesn't contract with any carriers and you would like to stay with them, that's fine. Delta Dental will pay them. However, the out-of-network providers may balance bill you the difference because they don't have a signed contract with Delta Dental.
Leticia?
Yes.
Is the orthodontia only for children, or can adults use it too?
On the PPO, it is only for children. On the DHMO, it is for children and adults.
Okay.
So I'll go over that here. So the DHMO plan with Delta Dental is similar to the DMO as you have to pick a provider. So if you don't designate a provider, Delta Dental will assign one based on your home zip code. At any time during the year, you can change that provider, and each person in the household may have their own provider. So on the DHMO program, there are no annual deductibles and there are no annual maximums. You can utilize the plan as needed and as much as you want. Your preventative care services, such as your cleanings twice a year and your x-rays, are going to be covered at 100%. Extra cleanings throughout the year are $45. Then your basic services, such as those cavities, root canals, endodontics, periodontics, crowns, bridges, implants, child orthodontia, and adult orthodontia, teeth bleaching, is all going to be covered at a fee schedule. I did attach the fee schedule to the invite, and you'll see it on there. It's a multi-page document. And you thumb through it, and it's got all the dental codes listed on the left side. And then if you follow that along, it tells you how much each of the services cost. On the screen is an example of what you have in the attachment. This is the diagnostic page, or some of the diagnostic page. There's a lot more included. And this is going to be your x-rays, this is going to be your cleanings, things of that nature. Those are going to be at no cost to the member. Okay. There are services for children such as the sealants. Those are going to be at $10 per tooth, and it's not limited to just the molars. It can be all of them, the perms for the children. And again, child orthodontia is about I thumbed through it and I think it was $2,100, and the child orthodontia is $1,900, and that's your out-of-pocket expense. That's not what they cover, that's your out-of-pocket expense. That's what you pay. That's why you have to designate a provider, because they've agreed not to charge more than what's listed on the fee schedule. So with Delta Dental, you will get ID cards for either the PPO plan or the DHMO plan. You will get them here probably at the end of this month, beginning of next month. You'll get ID cards. The DHMO plan will have a letter similar to what's attached here on the screen or shown here on the screen. You'll get your ID cards, you get a letter welcoming you, and you'll also get the name of the provider that has been designated if you didn't pick one. You can change the provider, as I stated earlier, online or via telephone. As long as you do it before the 21st of the current month, the provider is available by the 1st of the following month. So it's very simple to use. If you have questions on how to find a provider or you can't find one in your zip code, reach out to me and I'll be happy to help you maneuver through that. Does anybody have any questions? Okay. Some additional resources available through Delta Dental. Obviously, they have a website. You can go on there and download and print additional ID cards, do your provider search, check to see how much of the plan you've used, things of that nature. They also have a mobile app that you can also download, and again, it'll have your ID at your disposal. Next, we're going to go over the vision plan. So some changes here too. So the new vision plan is a partnership with Delta Dental. It is with iMed. So currently we have iMed on using the Select network. We will be using the Insight network. So a little bit difference there. You still have your exams available every 12 months. Because it is a new contract, you don't have to wait a full 12 months from whenever you received your exam in 2019 to get it in 2020. Typically, and this will happen in 2021, if you go in 2020 on March 1st to get your eye exam, then you will have to wait until March 1st of 2021 or thereafter to get your eye exam. But because it's a brand new contract and a different network, you can go anytime during the 2020 plan year. So again, your eye exam is going to be a $10 copay, and your frames are now available every 12 months versus every 24 months. You have a $120 allowance to utilize towards those services, and then 20% off in excess of $120. Then your lenses for your frames, single vision, bifocal, or trifocal, are going to be a $10 copay. And also, I included the summary in the invite, and you'll see now any lens treatments, tinting, polycarbonates, those are all now going to be at a copay versus a percentage of cost. So you'll see some savings there as well. If you are at contact lenses, you have an $80 allowance to use towards your contact lenses and then 15% discount above that. So your contact lenses are going to be available in lieu of the lenses for your frames. If you opt to get your contact lenses, but you still want to use that frame benefit, you may do so. And your lenses will be at a 40% discount. So you can obtain both within the same calendar year. You can use your FSA and HSA dollars to pay for these services as well. And then medically prescribed contact lenses are going to be covered in full. Again, we're changing to the Insight network. You're going to experience some of the very same providers that you use today. There's an enhancement to the network and a much deeper discount as well. Any questions on the vision? Okay. So we're going to move to the voluntary life and accidental death and dismemberment. So if you enrolled in the life coverage last time it was proposed, so this time last year, and you enrolled in even the minimum of $10,000, that will allow you to continue to increase 5 times your annual earnings up to $200,000 with no medical underwriting for yourself, $25,000 for your spouse, and $10,000 for your children. If you're new hire, newly eligible, that also applies to you. You can obtain that life insurance with no medical underwriting. If it was offered previously and you waived or opted out, and now you want to enroll, there will be some medical underwriting required and evidence of insurability. Any questions on the life insurance? Now, for those of you that purchase the life insurance, if you have a life event or need to change your beneficiary anytime during the year, please contact your HR representative here at CBR so we can change that beneficiary for you. You know, and it's very important that anytime that something happens that you have that up to date. Sometimes it's the last thing we think about. Or if you have a trust, put it into the trust name. Therefore, you don't have to worry about that. Disability, so this is voluntary coverage. So this is paycheck protection in the event that you can't work for off-the-job accident, sickness, or hospitalization. So the voluntary short-term disability will cover 60% of your pre-disability weekly earnings up to $1,000. The benefit will kick in after the 14th day of accident, sickness, or hospitalization, and the benefit duration is up to 11 weeks. There are pre-existing condition limitations both for the short-term disability and the long-term disability, which means if you were treated, saw a doctor, or were diagnosed 3 months prior to the effective date of the policy, that diagnoses will be excluded from coverage for 12 months. The voluntary long-term disability, again, covers 60% of your pre-disability monthly earnings up to $7,500 a month. The benefit will begin after the 90th day of sickness or reason for being disabled, and the benefit lasts until normal Social Security retirement age. Any questions on disability? Okay. You also have the access to some Aflac products that are listed here on the screen, and they're also in your enrollment packet. If you would like to have a one-on-one with an Aflac representative, please send an email to Jose or myself, or call or text him. His phone number is on here and on the forms in your packet, and he'll be more than happy to set up some time to speak to you. So the Aflac coverage are indemnity products. They pay you, the end user. They don't pay the hospital. They don't pay the insurance company. They don't pay the provider. They do not coordinate with any insurance. There is no network. So they pay you directly for sickness, hospitalization, accidents, critical illness for yourself. And if you enroll your family members, for your family members. There are life insurance benefits built into some of these, some wellness benefits built into these. So if you saw your doctor for your regular well man, well woman check, you can submit a claim and they pay. They have 24-hour pay if you use their app on your phone and you enroll in any of these products. So to learn more, and the reason why it's important to contact an Aflac rep is because they're very customizable and is based on your current family situation. If you're a single parent, single person, or a multi-parent family and children, the coverages vary. And once you lock in those rates, you're locked in for the length of or duration of the plan. So that it doesn't go up like the life insurance or the disabilities as we start to age. Any questions on Aflac? All right, we have other voluntary products, so Legal Shield and ID Shield, that is still available. If you're enrolled today, you do not need to complete any additional documentation. You would just continue to payroll deduct. If you're interested in enrolling in the Legal Shield, ID Shield, or the United Pet Care, there's information in your packets on how to enroll. You do have to enroll online for those services. So the enrollment packets or enrollment forms everybody received in the invite are due by the 9th. Whether you're going to enroll or waive, we still need one from everybody. No exception there. Your life and disability forms included in your packet only if you're enrolling or making changes. If you're just going to keep everything the same, we don't need that back. Your task form or your FSA form that's in your packet only if you're enrolling. If you already completed one, because there was an email that went out earlier this year, I think it was last month, and you already submitted that to CBR, you do not need to complete again. If you're enrolling in the high deductible health plan and you have not opened an HSA account, I recommend that you do that as soon as possible. You do need to have that account open in order for the company contribution and your money to go into. Does anybody have any questions? Did everybody get the attachments in the invite?
We did, and just so the team knows, I also uploaded that into our internal workplace platform, so you can access it outside of your Outlook if you needed it.
Awesome, thank you so much. Now, so those forms do need to be manually completed, or you can complete it on your PDF writer and sent back to your CBR team as soon as possible, so we make sure that everybody gets their cards on time for the medical, dental, vision, etc. If you use the electronic service before the Darwin Ed system, it is having a lot of technical issues, so I recommend a paper app from everybody. It'll be easier to process and easier for you to complete. Does anybody have any?
Who at CBR should we directly send them to? You or Marlene? Who should we?
So you're going to send them directly to Marlene. I think her information is in the body of the email with her
It is.
Okay, good. Send them directly to Marlene. Just click and attach the forms. If you have questions on what you have today, in regards to what you're enrolled in. If you're enrolled in the life and you want to know how much, email Marlene directly and ask her those questions so she has that information at her disposal. I unfortunately don't have it, but she has it. I can answer any questions in regards to the coverage, to what is covered, pharmacy questions, and everything that I've talked about earlier today. So I can answer all of those questions for you.
Okay, great. So team, take the weekend to discuss with your families, make your decisions for what you guys need for 2020. The form is due back on Monday, the 9th, to Marlene. I will be in contact with Marlene on the afternoon of the 9th to see where we're sitting with everybody's form that's required, regardless of if you're enrolling or not. And I'll be working with your managers to make sure everybody's form gets in on time. So that's the plan, to ensure CBR gets everything they need in a timely manner that they have for us.
Thank you so much. Does anybody have any questions? All right, thank you guys so much. I will send out the YouTube link later today, and it could be, I'll send it to Jenny Ray so she can upload it and have it available to those that were not able to attend, or if you just want to review.
That is great. Thanks, Leticia.
You're so welcome. Thank you,
Hey,
everybody.
Leticia,
Yes.
Leticia, it's Dale. Real quick. By the way, that was very informative and efficient. Thank you.
You're welcome.
Is there more information regarding the pet insurance online?
So in the enrollment packet, there is a flyer within the body, and there is also the link on there as well. You can click on the link, it'll take you to our site. And it does have more information on providers, things of that nature. I called my veterinarian and I asked them if they were part of the United Pet Care Program, and they fortunately are. So I was able to, get some really good deep discount for my dog's prescriptions and visits to the doctor, to her doctor.
Great, thank you.
You're welcome. Any other questions? Okay, thank you everybody so much, and have a wonderful day, and happy holidays to everybody.
Thank you.
Thank you.
Thank you.
Peace out, yo.